Could I also sort of start by again acknowledging the traditional owners of the land on which we gather and pay respects to elders, past, present and emerging, and to acknowledge and pay respect to the Aboriginal and Torres Strait Islander staff and colleagues and workers in the room over the last 2 days. And I segue, I think, from Auntie Rachel's comments at the end, endorsing Eddie's insights, and I think the challenge and the call to action for all of us. And I do want to commend to all of you who aren't aware of it, the Our Way strategy and the Changing Tracks action plan, which have, I think, historically been co-developed between Family Matters and government and the sector, but do herald a really transformational shift away in our thinking and the recognition of the absolute centrality of culture infusing in our services and our systems as the only way to actually reverse the growing overrepresentation of Aboriginal and Torres Strait Islander children in the child protection system. Can I also say, look, it has been a real privilege to be here for a day and a bit, and I just want to, on behalf of myself and behalf of all of you, thank Lindsay from Peak Care and his staff, Natalie, who's Crook, and her staff from QuadSIP for bringing this forum together with the support of the department. And could you please join me in doing that, because it was a courageous thing and an important thing for Lindsay and Natalie to agree to do. So please, can you join me in thanking them? We certainly saw huge value on a focus on ICE and the challenges it's posing for all of us. And that's not to say that we won't and can't deal with it in context or in perspective of the other factors in families' lives. Indeed, today's discussion in particular has reinforced how important that is. But nonetheless, I think as Marilyn said yesterday and the Minister has said and others have said, it's certainly emerged on our radar for our staff and for many of you, I'm sure, as a really complicating and escalating factor in both demand and complexity. So the fact that we've seen this sort of concurrent and cumulative impact of mental health and DV and parental involvement in child protection or in criminal justice and drug and alcohol, but especially ICE in the last couple of years, deserved a focused attention to it, even if it reinforces the need for holistic and integrated and cross-sectoral responses. Nonetheless, we have to develop our capacity across our services and our systems and our professional disciplines to effectively deal with this challenge. The fact that so many of you have come and stayed for 2 days is a testament to that. Like the thirst for knowledge and your presence and participation in the forum, I think, speaks to the need and demand for the knowledge sharing and the networking and the collaborations that have emerged over the last 2 days, Lindsay. So can I just thank all of you for your engagement and being here and being present and the challenging questions and no doubt the reflections that you've taken personally from what we've heard over the last couple of days. It is, I think, again, a demonstration of the power of multiple perspectives and bringing different sectors and views and viewpoints and voices to these complex challenges. And in particular, I did want to acknowledge, I missed some of yesterday, but I did want to acknowledge Nikki and Jane's contribution today in terms of the perspectives and voices of parents and their expectations of our systems and services, especially when we've taken their children. We want to infuse hope in all of our work. We don't want to be at the bottom of the cliff, and we've been working very hard with many of you and your organisations to build a scale that a ladder up that cliff and back over the top, to put up barriers so that families and kids don't go over the edge, and we can, if they do, we can push them back up. So, so the value of those multiple perspectives, I just think we got that in spades over the last couple of days. Certainly I did. And I do hope that all of us can take, particular things out of the last 2 days, and certainly one of them for me is sort of both sort of reinforced and challenged and motivated is, what leadership I can bring to that sort of cross-sectoral, cross-agency work. And I've gone away with half a dozen draft emails to send off to folk to follow up some of the things I've heard over the last day and a bit to a couple of my DG colleagues in other agencies, but also to some of you about some of the things we might be able to do together. So, for example, Cameron has and Reese have helped develop a brand new version of a training module for our child safety staff on methamphetamines. And we've made a commitment to make that available through Peak Care to the DV sector. And I just spoke to Cameron about, well, like you guys can have it too, and you can adapt it and put it back out through, whether it's through Dovetail or those other websites that look fantastic that you referenced, Cameron. So, so there's clearly a lot of benefit in some shared training and knowledge networks. So we've got to do more to sort of bring our sectors closer together. And some things that we've been doing that the Minister mentioned, like the nurses in our Family and Child Connect and IFS catchments, the CSOs in health and hospital services, the joint responses that have just been announced with QPS, and we're going to put some CSOs into the police intelligence unit to share information and facilitate joint responses, putting principal child protection officers into FACS and having DV workers in child safety centres. All of these things, and I noticed talking to so I'm not sure he's here or his name, but the collaboration between Churches of Christ and Drug Arm in the Family Intervention Service. Those sorts of examples of collaborative, interdisciplinary, joined up responses are just exactly what we need to do to drag and push and pull our services and systems together. And so there's some more of that to do. Can I just also finish by encouraging you to think about what more you can do too? Graham yesterday morning invited you to contribute to the public feedback consultation on action on ICE, so please take that opportunity. Lindsay mentioned the 3 messages you wanted to give me and the Minister. Please take the opportunity to record those and have them collected so that that can form part of the record and inform what we do next. It'll certainly, what I've taken, and I'm sure some of my staff who are here, this will very much inform the evolution of our Supporting Families and Changing Futures agenda. And it'll inform some of the design and some co-design work we'll do very soon about that extra investment, some for intensive family services, as well as the family intervention for families where ICE is an issue that the Minister mentioned, that we want to get out there in the next couple of months. So for me, I want to encourage the sort of collaborative and even consortia-based responses to those opportunities for that new investment. So when that hits in a couple of months, it'd be terrific if there were more of you working together to bid for some of that extra investment. So we can all get better at dealing with the challenges for the families and children that we're concerned about, been concerned about over the last 2 days. So thank you again. It's been a privilege to be able to have some time and listen and learn a lot. And thank you, all of you, for contributing to that. Thank you.